everyone, Leslie Cornwell, Certified Nurse Midwife with Empowering Midwifery Education. This next section has to do with recommended weight gain during pregnancy. This is a legal disclaimer we put at the beginning of all of our presentations. It's for general and educational purposes only. It's not intended to substitute for professional, legal, or clinical advice. We try to keep our information as accurate and timely as possible, but we also make no promises and guarantees that everything is up to date and fits your local scope of practice and regulatory standards. The course objectives: the student will be able to verbalize what exactly is weight gain during pregnancy, what are the recommended standards, what is safe, what is not safe, what are possible causes of weight gain, and what are the potential consequences of gaining too much weight during pregnancy. So why is this topic important? A lot of women really stress out about their weight gain during pregnancy. They don't know what's normal, what's not normal. We want to be able to promote healthy pregnancy and fetal growth by having good nutritional intake and a proper weight gain. And it's based on their specific body mass index, genetics, lifestyle. There's a lot of factors that impact the overall weight gain during pregnancy. What exactly is weight gain during pregnancy? Most women should gain between 25 to 35 pounds during pregnancy if they have a normal body mass index. With having 70% of the population around the world, particularly in the United States, where a lot of people are obese and morbidly obese, there is a difference in that weight gain recommendation. This is based on if you're normal, healthy BMI. Most women will gain 2 to 4 pounds during the first trimester, 1 pound every week after that point, especially towards the end of the pregnancy when the baby itself is growing about 1 pound and sleeping lots and really gaining extra fluid. There's more weight gain towards the end. For overweight women, it is less. It's closer to 15 to 25 pounds based on that pre-pregnancy weight. If you're underweight, we tend to, which is super rare to see nowadays in today's United States, it's on the higher end. You want to gain closer to 28 to 40 pounds. The more weight that you have on your body mass index, the less you're recommended to gain. If someone is morbidly obese, our goal is to encourage her to be healthier, exercise, good nutrition. She's going to be losing weight as the baby is gaining, so our goal is to keep them roughly around their pre-pregnancy weight and making sure baby is growing appropriately. And then with twins, you want to make sure that they're gaining closer to 37 to 54 pounds. More babies, obviously, more placenta, more fluid, more weight gain occurs. Recommended guidelines: if their body mass index is underweight, less than 18.5, it's 28 to 40. If they're healthy, 18.5 to 24.9, it's that 25 to 35 pounds. Many of the families we serve are in that overweight and obese and the different levels of obesity. So from 25 to 29.9 BMI, recommended 15 to 25, 30 or more, and it actually breaks down in more details, 11 to 20. Once they start getting into those class 2 and 3 of morbid obesity, they're really not encouraging the moms to gain much weight at all during the pregnancy. How do you safely gain weight during pregnancy? That's the million-dollar question, because you're, quote unquote, our cultural norm, eating for two, you're hungry, the sugar, you're feeling great. Sometimes your feet are sore and you can't be very active depending on the season and the weather and where you live. So we really want to focus on a healthy, balanced diet that the mom can intake all the good nutrition that's needed for the baby. They're averaging needing an additional 300 calories a day, not literally twice the amount of calories. And so that's an important education to have with families, that that's like an extra apple, that's an extra small snack. It's not literally getting double the portions. They should be gaining about 2 to 4 pounds that first 3 months, depending on how sick they are, and then around a pound each week after that point. If they're having twins, obviously there's going to be more weight gain and there's going to be more calorie intake requirements. causes a weight gain. It could be just the overall growth of the pregnancy, the breast tissue increasing, the fluid intake, the edema towards the end, the increased blood flow, the fat stores, the size of the uterus, the baby, depending on if it's 6 pounds to 10 pounds, the placenta, the fluid. So there's a lot with just the pregnancy itself that is causing the weight gain. And then just the metabolism and the foods that the mother is eating can affect that weight gain. It's a big hot question. Is it safe to lose weight when you're pregnant? If you're overweight, it may or may not, just depending on how severely overweight you are and if you're eating healthy. If you're exercising now and eating things that you never used to eat, you used to drink pop all the time and now you're drinking water. You used to do donuts and processed food and fast food, and now you're eating fruits and vegetables and really wanting to get your health going, you're going to lose weight because your body calories have drastically decreased, but you're still healthy. So it makes a big difference of, we don't want you to cut calories, we just want you to get good nutritional intake. And some women that are morbidly obese are going to lose some weight during pregnancy as that baby is continuing to grow. Is there a definition of what is too much weight during pregnancy? Women are so sensitive of their bodies and that number, and the biggest thing is we look at not so much the weight itself, but the risk it has to do with mom and baby for diabetes, for shoulder dystocia, for complications. I mean, even just postpartum, the weight retention and the lifelong primary care complications it can have from just gaining too much weight during pregnancy, before pregnancy, after pregnancy. Overweight women want to recommend to gain a little bit less, and which is a lot of the women in our society, unfortunately. So you just want to be very conscientious. We don't want to ignore this topic. We do want to address it, but we want to focus on empowerment of eating well, exercise, being healthy, portion sizes, and not literally eating for two, but those 300 calories. And then the weight gain, for the more obese you are, the less weight gain is being recommended for you. And it eventually is going more and more to guidelines of not really gaining much at all if you're pretty significantly overweight. Management of weight, we just want to go, it's a habit, it's a lifestyle thing. If they're not used to eating a certain way, they don't have access financially, driving what is cooked by their partner, the food access they have, we have to consider what is the best situation to support them with their weight management, being active, doing exercises that they can creatively do at home, being able to provide cost-effective, nutritionally dense foods sources for them, depending on the season. If it's in the summertime, farmers markets in the wintertime, it unfortunately tends to be more canned and processed, and then you get into the salts, which is a challenge with preeclampsia and swelling and weight gain that direction. So just making healthy choices, eating fruits and vegetables, portion sizes, small frequent meals, being careful of the fats, being careful of the desserts and the sweets, eating low fat, fat free, limiting some of the unhealthy choices. Instead of white bread, you're picking whole grain bread, limiting the carbs, being careful of cereals, eating some eggs for breakfast, making sure you're taking your vitamins, getting just a variety of fruits and vegetables into your diet every day. Foods to avoid, anything that's nutritionally it's empty calories. You just don't want something that's gonna give you a ton of calories, but then you're still hungry because of the cornstarch, the syrups, the sugars, the processed foods, the cookies, the cakes, the donuts, the ice creams, the chips, the pizzas, the fast food. There's so many calories, and they don't fill you. They don't give you the nutrition you want, and you're still going to be hungry very shortly. Being careful at eating out, the portion sizes are higher, you're around people, you're more sociable, you're going to eat a lot more, you're not going to listen to your body. It's a cost factor too. It's hard to plan ahead. You can eat out, just being careful of more salads, maybe instantly putting half the plate into a to-go container so that you're automatically avoiding the large portions, and avoiding fast food if you can. There's the grease, the salt, the sugar content is just not recommended during pregnancy. Cooking at home as best you can, prepping meals, doing it grouping, taking some cooking classes, trying not to fry things, baking them, grilling, boiling is a lot healthier than frying. And just being conscientious of really great recipes out there with fruits and vegetables and healthy oils to make a well-balanced meal for you. Great exercises that are available. You can do walking, you can do swimming, you can do a lot of great things. Yoga, Pilates. You don't have to get hardcore getting ready for a marathon, but it's also a benefit for exercise with your birth outcome and positions. And you're going to do some significant endurance when you're laboring and birthing out your child. So it's good to have exercise and some muscle tone and endurance present. So just to summarize this section, the gestational weight gain varies greatly depending on the pre-pregnancy body mass index. It can go from practically nothing recommended to gain up to 40-45 pounds depending on if they're underweight, if they have twins. So there's a wide variation of normal, and we want to get to the root cause. We want to focus on healthy body images, weight promotion, healthy choices, drinking water, fruits and vegetables, an additional 300 calories, not literally eating for two like our culture. So you want to avoid judgment, you want to avoid biases, you want to empower them and get to the root barriers, whether it's habit, whether it's access to resources, whether it's a cultural norm to eat a bunch. Like, you really want to help support them so they can understand the risk of the additional weight gain, not just for the pregnancy and birth, but long term on their overall health. So our job as midwives is to advocate and really just to help make them get more habits that are going to lifelong better them and the child that they're feeding long term, and continuing those food nutritional habits.